Actually, it was a little over a year ago that I found out that I had cancer, and I went in to see the doctor because I thought I had some acid reflux problems and a little bit of pain. I started getting pain in the chest and right around the shoulder blade and stuff. So it was kind of strange. I thought it was just maybe really bad indigestion or whatever. So we ended up doing an endoscopy to see what was going on, because the pain just wasn't subsiding. And when we did the endoscopy, we found that I had a big tumor in my esophagus. Once we had the scope work done, and they realized that there was a tumor down there, they brought in Dr. McNamee, was right down the hall, and he came over and to take a look at, the x-rays and the films and stuff to see what was going on. So he kind of like brought me in and consoled me and talked to me about the whole situation on what I was going to, and set up some appointments to visit with him on, so I'd get a better understanding of what was going on and what I had and the condition that I actually had. When I first found out about it, I was in kind of shock and disbelief, because it was like I was going in for a routine procedure to find out what was wrong with something else, and they came out and said that. So I don't think I realized exactly what I had for several days, because I don't know if I just didn't believe it or not, but it took me several days to actually understand and realize that I had a disease that I need to get rid of. And over the course of a week, I think it finally set in after about a week that I had to take this a little bit more serious than I thought it was, because I wasn't, at first I thought it was, well, maybe it's just a little thing that I'll just cut it out and I'll be done with it, but it ended up being a lot more than that. Finally, once I ended up meeting in an office visit with Dr. Constantine and Dr. McNamee, because they kind of went through the whole scenario of, well, you're going to have surgery at some point in time, but you're going to have to go through chemotherapy to start off with, and most likely have to have radiation treatments to go along with that. So we decided that was probably the best to do, to have the chemotherapy and the radiation treatments prior to having surgery, and would see what would happen at that point in time. And that actually got rid of the tumor and stuff, but there was a lot of scar tissue left. So we had to still proceed on with surgery, which guess I was trying to be hopeful and I wouldn't have to do, but we ended up doing that. And they were, they both were very settling for me. When I was dealing with Dr. Constantine, he was, very supportive of my condition and was trying to look on the bright side of everything, which was good, because I needed a lot of reassurance at that time. And after when somebody tells you something that you have cancer, it's, that's a major blow to you. And he was, he was almost like a father to me, really. So he took me under his wing and guided me through all the things I needed to do, and made me feel very much at home of what I was going to actually go through, and he explained, all the procedures and stuff. His personality was, pretty much right to the point, but he kind of sat back and explained it a little in, less technical terms to you, so you really knew what was going on and what, the effects that you were going to have and stuff. So it was, he was very reassuring that I'd do pretty well on this. Oh, the oncology staff was really good. I had a really good time with all of them. They were like brothers and sisters to me. They were, treated like family, and everybody was reassuring and helped you out, anything that you needed, and very patient with people, which was really nice. They actually cared, which was, a good sign. So it was a very friendly atmosphere, and you didn't mind talking to them, and you could talk about just about anything with them, and they set your mind at ease. So it was very nice. The whole gathering of Dana-Farber with Milford, that's really good, because they're one of the, well-known, renowned places for cancer treatments and stuff. So having something coming out of Boston into the suburbs was really nice. And I thought it was, pretty good fit, that the people here and the people in there would work well together. So I think it's great. Having everything under one organization or one umbrella in one location would have been really great. And, you know, for me personally, just because I wouldn't have had to travel all around different states or different parts of the state to get, you know, like radiation treatments or whatever. So, and I'm sure as far as the people working with the patients, whether they're relatives or just friends traveling, because some people can't travel and don't do so well when they're having these treatments. So having something in one location where it's in walking distance stuff, that's great. That's really great. Right now I'm doing great, so I haven't had any problems. I'm back working full time, riding horses, doing everything that I really want to do, so it really hasn't had much of an effect on me.